I'm curious. I am curious. Curious.
By nature.
Welcome to Curious by Nature. I'm Jessica Johnson from Newswise. When it comes to sports injuries, recovery isn't just physical, it's mental as well. Dr. Tiana Woolridge, primary care sports medicine physician at the Hospital for Special Surgery, studies how sleep, stress, and mindset affect injury risk and recovery in young athletes. Her work bridges physical health and mental resilience, helping athletes heal stronger inside and out. Dr. Woolridge, welcome to the podcast. Please introduce yourself.
I am Dr. Tiana Woolridge. I am a primary care sports medicine provider at the Hospital for Special Surgery. I am curious about the interplay between mental health and physical health, particularly as it relates to injury, risk of injury, and recovery from injury. In the primary care sports medicine space, we operate in this interesting middle ground between orthopedics, so bone and joint, musculoskeletal health, and also primary care medicine. So thinking about the whole entire health of an athlete and of an active person. And so naturally what falls into that is thinking about how does an injury impact this person's overall health and well-being, which includes their mental well-being. So a current research project that I'm working on with a handful of folks at HSS is looking at risk factors for injury in our young athletes. So again, thinking about some of our biomechanic risk factors, the way athletes jump and land and all of those things, but also thinking about things like sleep and thinking about mental well-being, seeing if we assess these athletes before their season begins for, any musculoskeletal biomechanics issue, but also issues around kind of what mental well-being, around sleep issues, stress levels, things like that. And we track them through the season and see who gets injured and who doesn't. Can we see if there's a connection between any of those factors that we identified early on and risk of injury during season? Because again, what that gives us a chance to do is to appropriately target potential interventions, right? So if we say, okay, let's look at how everyone is landing or how everyone's jumping, or let's look at how everyone is sleeping. Okay, we identify you're only sleeping 6 hours a night, or the way that you land on this leg is, your knee is caving in when you're landing. All right, we know that this is a risk factor for getting injured later on. Let's address this now so that you don't end up losing time from your season.
So tell me more about how you engage with those two things. Particularly, I mean, I can understand, being at the Hospital for Special Surgery, the physical component. I mean, I'd love to hear also about that and ways that you're um, working in terms of finding new ways to improve people's physical health when they have an injury, but then also how are you affecting their mental health?
Absolutely. So, one thing I didn't mention earlier, I am predominantly a pediatric sports medicine provider. So, I did a residency in general pediatrics. I'm a general pediatrician in addition to being a sports medicine doctor. And so, it's a fun and unique zone where I'm trained and understand a lot about the developing body and also the developing mind. And so, the nuance that I bring to a place like HSS, which is, been number one in orthopedics for the last 16 years, running, hopefully. There's so much excellence in terms of understanding the human body and how to put together broken bones, broken joints, broken ligaments. But I think also an important shift that's happening, and I hear this from a lot of my surgeons, and there's a lot of wonderful physical therapists and psychologists at HSS who are already deeply engaged in this work. We're understanding how we can essentially use injury or these physical traumas or mental traumas that happen as a launching pad to get you back to your sport better or how to kind of improve the return, right? So if an athlete comes to me and they have an overuse injury or they're dealing with tendinitis or chronic aches and pains, I can help them address what are the biomechanical factors that are associated with this, right? Is the way that you're jumping or landing or squatting, showing that you have weaknesses of your core, of your glute muscles? Is there some imbalance of your mobility based on your hamstrings compared to your quadriceps? And is that potentially contributing to injury risk? And so, yes, we can address those. But again, my focus and what I'm really passionate about as well is like, how can I also help develop this young person from the mental perspective? They're going to face challenges in life, whether it is a hard getting a bad grade on a test or, not getting into the school they wanted to get into or facing hardships in adulthood. So with this hardship they're facing right now, like how can we teach some of those mental skills to get through that? So that's something that I do often with my patients in one-on-one settings and my clinical encounters. And again, we do have a handful of folks who are working in the sports psychology space at HSS who really lean into this work.
What would you imagine are the ways and like those points of connection from mental health, like depression, anxiety issues, to how that affects someone in their athletic life? Is it about sleep? Is it about nutrition? What are those areas that put them at most risk for getting injured?
Yeah, that is a great question, and that exactly points to where we need to see more research being done. So, there are a couple of studies out there that put hypothetical theories as to why certain athletes, again, with depression, anxiety, unaddressed mental health issues, anger issues, substance use issues, or substance use disorders, that, when they're playing their sport, they experience some narrowing of their peripheral field. Their attention is not fully focused on their game and on assessing risk and protecting their body from risk. So those are some, again, theories, which is, tries to explain why this connection exists, but we don't have a great understanding yet. And if I had to suppose, and as you were just expressing to me, it makes sense, right? When we think about if you're depressed or anxious or dealing with a mental illness, you're probably not sleeping well, which means you're probably not recovering well. We know that there's a very clear connection between poor sleep and a variety of different health issues. If you're not eating well, if you are not, you're just existing in a state of chronic stress and there's a lot of stress and inflammation in your body, that's probably having a connection to increased injury risk. But again, we haven't figured out or defined those pathways clearly enough yet for us to be able to really take action.
What about issues like burning out from doing one sport? Or now do you see that children are starting early and doing one sport and focusing on them? And is there a mental health component in that as well?
So there has been a huge issue in the field of general pediatrics as well as in pediatric sports medicine, recognizing this concept of early sport specialization. And so that specifically means specializing in one sport year round at the exclusion of all other sports before the onset of puberty. And what we have found is that athletes who do this are much more likely to suffer more injuries because they're using the same patterns, the same movement patterns over and over again. You think about your young baseball player who's playing baseball, your pitcher who's like throwing with that same arm 12 months out of the year. Those are the athletes who come to me and they have damage to their growth plates or they have tears in their elbow, which, are way too young and could have very easily been prevented and avoided. But unfortunately, there's so much pressure out there, right? Everyone's talking about trying to get their kids to a good college. Everyone's talking about, there's a lot more money making opportunities in even college and high school sports these days with the onset of the name, image, and likeness policy, which allows young athletes to profit off of their own name and image, which I couldn't do back when I was a college athlete. So for better or worse, but there are a lot of increased pressure these days on young athletes. And so what that turns into is a lot of people capitalizing on that, right? A lot of athletic leagues saying, oh, well, you got to get your kid in personal training and they have to play in this club team and this club team to be able to make it up to the next level. And so, of course, parents are like, well, I want to do the best for my kid. I want to give them the best shot at being excellent. And they take advice from people who are not trained or not knowledgeable in youth anatomy and youth development.
I was thinking about what your teammates were saying about being tired of it. And this would probably be impossible even to study, but where even there's some subconscious connection of like, give me a break from this and getting injured.
Right. So I definitely think there is a connection between, your motivation levels and your training volume, right? If you think about it, if you are stressed, right? Like you've got just high levels of stress and anxiety because you're like, I don't really want to go to this practice. I don't really want to go to this game. Like, I don't want to go to this training. You're existing in this chronic low level of stress. So your cortisol levels are high. Your, sympathetic nervous system is turned up. And we know that chronic activation of your nervous system, your sympathetic nervous system, can increase your risk of a lot of different illnesses, right? Like high blood pressure, diabetes, like there are a lot cardiovascular issues. So We know that for just kind of generalized health in medicine, like general public health research. And I'm sure that that comes into play when it comes into athlete and injury risk, right? There's definitely ways in which stress probably increases inflammation in the body, which is likely contributing to increased risk of injury or just chronic, tendon irritation or increased risk of, um, you know, again, like when we get to the attentional focus issue, maybe not appraising risk in the same way that you are because your attention isn't fully on the game and on what you're doing. And maybe impacting how much you're like participating in training or putting into your we do a lot of like weightlifting and a lot of almost like pre-rehabilitation work to try to prevent getting injured when we get out there. So if you're not buying into those things anymore because you're so exhausted, like you're not doing your rotator cuff warm-ups and your kind of ankle strengthening work, you're not really leaning into those things that could also increase risk of getting injured down the line.
If you can tell me more about weighted vests and if there are always just pure advantages or if there's any disadvantage to them.
Yes, there's definitely some benefit that you can get from it. Largely a cardiovascular benefit. So when you're working a little bit harder, you have more load on your body. Your cardiovascular system, your heart and your lungs have to work a little bit harder just to overcome that weight. And so you are getting some improvement in kind of lung function, heart function from that. A lot of people will wonder about, oh, this is making me stronger, or it's going to be more of like a weight workout or weight training. We don't see quite as much of a gain in kind of muscle hypertrophy or muscle growth, or in strength with just wearing a weighted vest. That's really going to come from that time, in the weight room, actually moving, lifting dumbbells, barbells, things like that. So the primary benefit that you're going to get from that is more of the cardiovascular benefit. Though you will feel potentially a little bit stronger, especially when you take the weighted vest off after your workout or after your walk. People tend to feel a lot lighter. But again, mostly the benefit you're going to get is cardiovascular. When it comes to the potential risks, there are always potential risks when people start to take health information or advice from the internet, and so that's always a little bit of my, like, hesitation about following some of these health trends that you see online. It's really important to recognize, like, what is an appropriate weighted vest for you. Like, just if you see somebody, doing pull-ups and push-ups and all this stuff with, like, a 20-pound weighted vest on, like, that doesn't necessarily mean that's the best for you. And so, really, really starting light is super important and making sure you have a good snug fit of a weighted vest is very important. You don't want anything that's going to be altering your gait too much. So some people will put on a very heavy weighted vest and then they're kind of arching their back because it's like so heavy it's pulling them down. Then they can start to develop, chronic back issues, issues with their discs and their spine. Like there's all kinds of long-term effects that can come from just being overly weighted in a way that your kind of core strength isn't able to tolerate. So there are risks of, developing other injuries, injuring your hips or back, things like that if you're putting too much weight or if you're increasing the amount of weight too quickly. So I usually tell people start around, 5 to 10 pounds, do that for a week or two, gradually increase by 2 or 3 pounds over the next few weeks if they're interested in, advancing a little bit more. But in general, listening to their body, that is a huge, huge thing that I say over and over in clinic. We do a lot of just pushing through pain and just saying, you know what, whatever, it's fine. Like I can make it through. But it's really important, especially when you're adding load to your body, to listen to your body.
What about for osteoporosis or osteopenia?
Yes. So for people with low bone density, we talk a lot about the benefit of weight bearing exercise to help support bone building. As I mentioned earlier, the benefits that we see from wearing a weighted vest are more so cardiovascular than for weight building. And so I still hold to the fact, even if people want to do that, as wear a weighted vest while they're exercising and they're doing it safely, by all means go for it. And I still recommend doing formal at least 2 times a week weightlifting sessions where you are picking up weights and doing, your bicep curls, presses, doing squats, like doing actual weight bearing exercises in the gym, again, for at least twice a week. So, want to make sure that that message stands true, that that's not necessarily a replacement, but it's something that could be an adjunct.
For, let's say, the weight lifting for osteoporosis or osteopenia or bone density, would you say that it's necessary to have a certain amount of weight? How do you know how much is enough?
It's really fine to do anywhere between like 5 to 15 pounds. You don't have to be a bodybuilder. You don't have to, do a huge 1 rep max of like 200 pounds when you're squatting. But it's really about the consistency and it's about moving some degree of weight. We know that load on the body and load on bone helps to build bone mass and healthy bone mass. And so that's why we make that recommendation there. But of course, too much load, the body is a tricky animal. So it wants some load, but not too much load. Because if we get too high, of course, we can cause our joints to kind of grind against each other. And if you already have existing arthritis, cartilage damage inside your joint, that can flare up underlying arthritis in your joints. If you're, I do see patients who are in their 60s, 70s, 80s with lower bone density who do heavy, training, weightlifting, or something that their body's not really prepared for, can actually develop stress fractures, bone stress injuries. So really important to make sure that once again you're listening to your body. If things are hurting, if things are feeling too heavy, listening to that and going a little bit lighter. Because again, it's more about consistency and just moving, even if it's 5 pounds, 10 pounds, doing 10, 12 to 15 reps of bicep curls, squats, lunges to whatever depth feels most comfortable for you and your joints. That's where you're going to see the benefit over a long-term period of time.
Where do you see the most benefits? What is PRP? I think sometimes people get confused between stem cell injections and PRP. If you could explain the difference.
Yeah, absolutely. So, platelet rich plasma or PRP, I tell people it's your own blood that we are drawing from you. We put that blood into a centrifuge that spins it around to separate out the different components of the blood. So, we get rid of the red blood cells, which are like the oxygen carrying cells in our body. We get rid of the white blood cells, which are like the infection fighting cells in our body. And we keep just the plasma, which is kind of this yellowish looking substance. And the plasma is filled with platelets. And when we inject that into your joint or around a tendon, it basically releases these growth factors and sets off this inflammatory response that tells the body, hey, there's damage here that needs repair. And then that sets off your own body to do the repair work for you. And so the benefit of that is for people with mild to moderate knee osteoarthritis, hip arthritis, chronic degeneration to their tendons in their bodies, so the Achilles tendon, the tendons around their elbow that help you move your wrist around. So if you've heard of tennis elbow before, those have the best data to support. PRP has the best data in those cases to actually reduce pain, improve function of all of those areas. So it's typically those patients that I'm recommending it for. Patients with that, mild, moderate knee degenerative changes around the foot and ankle or around the elbow. There are a couple of different data. There's mixed data showing benefit for shoulder osteoarthritis. There are some people who are putting it in and around the spine, but again, data gets a little bit fuzzier. In the next 5 to 10 years, I'm sure we're going to have much better data, but just from having more numbers of patients out there who have undergone this therapy. But as of right now, in my own practice, I'm usually doing it around the knee, hip, or the ankles or the elbows. Now, stem cell therapy is different. It is not something that I personally use or personally practice. There's a lot less data to support its benefits. For this type of treatment for like knee osteoarthritis, hip, you'll always have providers out there who will do it for you. But again, our medical data as of right now, it doesn't really support the routine use of stem cells for this type of treatment as it compares to, PRP. So stem cells, the idea, and there's a lot of different places where you can get stem cells from fat tissue, bone marrow. Basically, the idea is okay, we want to inject these cells, which are basically progenitor cells, meaning that they're cells that can differentiate or turn into anything. So if we can inject these cells and then they bind to cartilage and they like form new cartilage. Incredible idea, incredible concept. But again, there's not enough data to really support its use routinely. So again, it's not something that I practice. It is out there. People are doing it. People are studying it more in lab models. People are trying to get more data. So again, in the next 5 to 10 years, someone may listen back to this podcast and say, "Oh my gosh, I can't believe Dr. Woolridge said that. We do this routinely." But as of right now, it's not really something that's heavily supported by the medical literature.
So I also read that you are an expert in concussion management. And so is there any new updated information about ways that people can heal their concussion in a better way?
Absolutely, absolutely. So Not only do I treat concussion on a daily basis, I also spend a decent amount of time trying to educate our general practice providers, pediatric providers, about how to appropriately treat concussion. Because there are a lot of myths out there. We don't, in our medical training, medical school residency, we don't get a lot of great education in how to treat concussion. The idea was traditionally, and a lot of people may, remember hearing these types of things. Oh, you have a head injury, don't let them sleep. Kind of keep them up for 24 hours because if they sleep, they could die. So it's like keep them awake. The idea of like as long as you have a headache or as long as you have any symptoms, you cannot exercise. Like do not exercise for like a month or 2 months or 3 months or until your symptoms are better. So those are two specific ones that we are finding are like absolutely not the case. And we found that those things, those pieces of advice can actually prolong recovery from concussion. And so the first two things that I always tell people, again, specifically when I'm talking to providers who manage, young people and athletes and people who are likely to experience a sport related concussion, I tell them, first and foremost, as long as they don't have any red flags for like brain bleeding, for example, or anything that makes you more concerned that, again, they need to be in a hospital where they need to be managed and monitored in that way. As long as we rule those things out and we've observed them for about 4 hours and they're not necessarily getting worse, things seem pretty stable, let them sleep. The brain does need sleep to recover. What happens with a concussion, there's this huge energy crisis that's happening deep inside the brain. So there's injury to brain cells and to those connectors between brain cells, while at the same time, those cells need a lot of energy to recover. They need a lot of glucose. They need a lot of things to recover. But again, there's this mismatch of like, there's huge injury here. There's a lack of sufficient energy to recover from it. So again, sleep, just shutting down your metabolic activity and just allowing your brain to heal is very, very important and something that I talk about often. But there are some interesting data, not the strongest data in the world, but strong enough that I support using it, that taking supplementation with magnesium and vitamin B2 can be beneficial in concussion recovery. Those are two supplements that are regularly used by neurologists, particularly in the treatment of migraine disorders, because again, it has been shown to kind of reduce and help prevent migraines in people who get frequent headaches. So when you think about it, in concussion, when your main symptom is headache, and we know for some people who have, especially multiple concussions, they're actually more likely to go on to develop a headache disorder. Initiating that supplementation with magnesium and B2 can be really, really beneficial to treat those symptoms. So, with pretty much all of my injured athletes dealing with a sport related concussion, I will start them on those two supplements as long as there's no other indication to not do those.
Can you tell me what your account is on Instagram or other social
Well,
media?
yes. So I have technically two. My main one is Call Me Dr. T, Call Me Dr. underscore T. Is the main that I use. And then I have one that's kind of specific to HSS. That's Dr. underscore Woolridge. Where I basically just post anytime I do an HSS event.
Wonderful. Thank you. That would be great. And I'm sure that many people would love to follow you to get updates about that mental health and sports injury connection. It was wonderful to speak with you and to know more about you and what you're working on.
Curious by Nature is a production of Newswise. More than 7,000 journalists get the Newswise wires. Visit newswise.com and find out how to spread your news today.